Good morning to everyone. I am Dr. Saravana Kumar, consultant nephrologist at Muthuminakshi Hospitals in Pudukkottai. The topic I'm going to discuss about today is peripheral edema and chronic kidney disease. So, first of all, going into the topic, we have to look at what is peripheral edema. So, peripheral edema is a condition with one of the most essential features to identify in patients in the general examination. So, peripheral edema, what we identify is whether there is any uh, excess fluid in the body which is accumulated in the lower limbs. That is what we assess by checking for the peripheral edema. So, in the peripheral edema, how do you examine this? We have to look for the foot and also in the lower shin region, whether when you press your finger, if there is any depression, then you have to identify that you are starting to develop peripheral edema. So why does this occur, this peripheral edema? What is the reason these patients develop this peripheral edema? Because of the excess fluid which gets accumulated in the body, this peripheral edema develops. So commonly the fluid should be present either inside the cell or the minimal amount will be present in the extracellular around the cells, and some amount of fluid will be present in the blood vessels. But when the total fluid volume in the body increases, the amount of fluid in the present in the between the cells increases to a massive extent, and it manifests as peripheral edema. And since fluid is a gravity dependent, it gets accumulated in the lower limbs first. So by identifying this, we could have an initial assessment of any pathology which can be due to many causes. So one of the many causes regarding the many causes which lead to peripheral edema are mainly it is maybe due to a cardiac failure, it may be due to a renal failure, and also it may be due to a hepatic failure. All these three conditions usually predispose the patient to peripheral edema. The other ramifications also tend to occur, such as varicose veins or local lymphatic edema also can mimic this peripheral edema. So, regarding now moving to the chronic kidney disease, this is renal disease is quite common now, and each 1 in 10 people tend to have a renal disease at present. And this renal disease progresses gradually over a period of time, and it has been classified into 5 stages. This chronic kidney disease from stage 1 to stage 5, and in the 5th stage, predominantly most of the patients tend to develop this peripheral. But if you examine these patients at an earlier stage, that is on stage 3, you will be able to identify this peripheral edema so that we can give adequate treatment for these patients at the early stage. Why it should be treated is this edema is itself a significant factor in making the progression in advancing the disease. So it should definitely be treated at the earliest stage. Now it is not. You should not neglect it at the earliest stage. So CKD. So what are the common causes you see for CKD? Diabetics is a very pandemic. You should say it is a pandemic, and it is so exuberant in India at present. And most of the patients out of the 100 patients who are diabetes, around 30 to 40% of patients, 40% of patients tend to develop renal disease, and they are out of this 40, around 15 to 20% progress to end-stage renal disease requiring dialysis. So it is essential to identify such patients at an earlier stage, for which identifying this peripheral edema is very important. So after identifying this, what is the treatment needed? Definitely, we have to continue with the other medications, diabetes and the other renal disease causes, but also we have to treat the peripheral edema by using the main thing for peripheral edema treatment is you have to advise the patient to restrict their fluid intake. What people tendency to think is that once in order to prevent kidney disease, you have to take a lot of fluid. But this is not the case when you start developing this peripheral edema. You have to suggest the patient to restrict their fluid intake. It should be less than 750 ml per day, which includes all the fluids, not only water, but also other beverages, coffee, tea, and any other liquid which they are going to take. So the initial first and foremost step is restricting the fluid intake. The next one would be we have to suggest the patient to restrict the salt intake. Salt is also because salt is normally the Indian diet contains around 10 grams of salt, which is very high, and we have to advise these patients to restrict their salt intake and also uh, restrict their enriched food items such as preserved foods, processed foods. All these contains very high salt content, which should be brought down. This also goes on to help the progression of pedal edema to a much greater extent. So next, after both these are the most important. These two are very, very important. Unless you are going to follow this, no other medications are not going to work. So third one only will be these medications. These medications most important. What usually your doctor would prescribe the diuretics. Diuretics, both, that is diet. There are many diuretics, of which most effective and efficacious one would be this torsemide, which is a drug which increases the fluid output, which increases fluid exit from the body by acting in the kidneys. They help to decrease the absorption of fluid from the kidneys, so that it tends to decrease the fluid in the body. So it depends on the BP level and also your pedal edema, how to what extent this pedal edema is there. It can be the dose of the diuretics has to be titrated. Certain patients tend to develop certain complications such as cramps or giddiness during the administration. And so that it should be monitored, and according to the patient's symptoms, it has to be titrated. So definitely, controlling the pedal edema plays an essential role in preventing the progression of renal disease. So it is a very, very important step which has to be monitored frequently. It is very difficult to convince the patients to continue with the progression to be diet and salt restricted, but we have to stress that point repeatedly to these patients. Even when patients go in for hemodialysis, this pedal edema is a grave prognostic sign. So we have to advise the patients to be fluid compliant and also continue with the diuretics. Thank you.